I kind of feel like as a physical therapist that takes care of women, and I watch women and I screen women for perimenopause, and then I watch them get on hormones. It is like magic. It is something you cannot unsee. And I started talking on this platform about hormone replacement therapy because I thought, people kind of think it's the devil, according to research that was bad in 2002. And yes, we do know that some people cannot do HRT, and in some people it's really warranted. But in my practice, watching women go on hormone replacement therapy, it is like watering a plant that is wilted. Their skin becomes more plump, their hair becomes more hydrated, their joints move better, their irritability is less, they're sleeping better, their ears don't ring anymore, they don't have vaginal dryness as much. You need a topical estrogen for your vagina, just to let you know. So like you could take HRT and you need it probably for your vagina. Anyway, it's magic. It is magic. And so I have this unique lens of taking care of women through all the stages of life. And a lot of my patients I've known 5, 10, 15, 20 years. I know their mothers, I know their daughters. I cannot tell you enough how it is one of the most magical things I've ever seen happen. And that's why I started talking about it, because as a physical therapist, if you are doing your exercises and you're doing your joint mobility and you went to the orthopedic doc and they're like, yeah, you're fine, your joints are fine, but they just have all this widespread joint pain, it's your hormones. Now, imagine one of your best girlfriends that did get breast cancer and they put her on tamoxifen. Tamoxifen blocks all the estrogen. And if you saw your girlfriend have cancer and get on tamoxifen, the pain, the stiffness, the morning stiffness, walking really slow, doing slow yoga is about one of the only things that help their pain. Just warming up those joints and just constantly moving. And then one day it hit me that is a fast forward chemical version, very condensed version of menopause. And when we experience it naturally without being put on something like tamoxifen, it is 5, 10, 15 years. It's drawn out and you don't know. When you're put on tamoxifen, you know that they're blocking the estrogen and you realize that. But as a physical therapist, as my client patient population ages and have taken care of these women, it's just mind-blowing. I have this badass patient she's just amazing. She's brilliant. She's smart. She's funny. She's a quick wit. She's hardworking. And the other day on my table, she was just like sobbing and she couldn't handle life, and it wasn't her. And I was listening to her symptoms about itchy ears and widespread joint pain and weight gain, and her belly's fat, and she hasn't done anything different, and she just cries all the time. She's like, I could cry right now. And she started crying right now. And I was like, you're in perimenopause. And she's like, no. I'm like, yes, you are. You need to talk to your doctor. And she's like, what? I'm like, just trust me, please. And I promise you, when she comes back in a few months and she's on HRT, she'll be like, I feel so much better. And that's the story I hear all the time. So I'm glad. It does change lives. Truly,